All right, welcome to another deep dive. This time we're going to be talking about something that you might not expect, rheumatoid arthritis and how it can affect your lungs.
Oh, that's interesting.
We've got some excerpts from a medical textbook here. It talks about something called rheumatoid lung. I know, not
Yeah.
the most exciting title, but we're going to break it down for you.
Yeah, I mean, most people think rheumatoid arthritis, they think, oh, joints, pain.
Right, exactly.
Yeah.
But it turns out it can do a number on your lungs too.
Wow.
The textbook uses this case study, which I always find helpful. It's about this guy. He's got rheumatoid arthritis.
Yeah.
And right away, the book points out he's got, like, the classic signs in his hands, like, fingers bending in weird ways, knuckles all out of whack.
Yeah.
So I'm curious, how do those connect to lung problems?
Well, for doctors, those are like red flags.
Mm-hmm.
They see those hand deformities, they immediately start thinking, okay, could there be something going on with the lungs too?
So it's not a for sure thing, but
Not a guarantee, but it's definitely a clue. They'll start investigating further.
like a little warning light goes off in their head.
Exactly. And, the first thing that might come to mind is something called interstitial lung disease, ILD for short. But it's important to remember that's not the only thing it could be.
Okay.
This textbook actually lists a whole bunch of possibilities.
Yeah.
Bronchiectasis, pleural effusions, pleuritis. You can even get a raised hemiddiaphragm. And there's even a rare one called obliterative bronchiolitis. It's a type of obstructive lung disease.
Wow. Okay, so there's a lot of potential lung issues, huh?
Yeah, more than you might think.
Now, the case study, it mentions that the doctor heard something called bilateral basal crepitations. What in the world is that?
Okay, so that sounds super complicated, but it's actually pretty simple.
Okay, good.
Basically, it means the doctor heard crackling sounds when they listened to the bottom of both lungs with a stethoscope.
Oh,
It's not a specific diagnosis in itself, but it tells the doctor, hey, we need to look into this further. Could be ILD, like we talked about, but it could also be bronchiectasis, or even, something totally different like heart failure or pneumonia.
so it's more like a symptom than a disease itself.
Right.
Okay. Well, we've mentioned ILD a couple of times. What exactly is it? What does it mean for someone's breathing?
Okay, so think about it this way. Imagine your lungs are like balloons. You need to be able to stretch them open to fill them with air, right?
Right.
But with ILD, the tissue in your lungs, it gets stiff and scarred. It makes it hard to fully expand your lungs.
Oh,
That's what we call a restrictive deficit. It's different from obstructive lung diseases like asthma or COPD, where the airways themselves are narrowed. In ILD, the lung tissue itself is the problem.
so it's not that the air is blocked. It's more like your lungs can't stretch properly.
Exactly.
Okay.
Yeah.
And that can make it tough to breathe, obviously.
Yeah, it can really affect your ability to breathe comfortably, get enough oxygen.
So I'm guessing, like, figuring out what type of ILD someone has, it's probably pretty involved.
Yeah, it can be a whole process, often involves a whole team of specialists, doctors, radiologists, sometimes even pathologists.
Wow.
They all work together, to piece together what's going on. The textbook mentions they have these multidisciplinary team meetings where they'll look at blood tests, imaging, like uh, chest x-rays, CT scans. They'll also do pulmonary function tests, which measure how well your lungs are working.
Right.
And sometimes they might even need to do a lung biopsy. That's where they take a small sample of lung tissue and examine it under a microscope.
So they're really trying to get the full picture.
Yeah, absolutely. Leave no stone unturned.
And once they have a diagnosis, I'm assuming the treatment depends on the specific type of ILD they find.
Right. There's no one-size-fits-all approach here.
Makes sense.
Like, for example, if the ILD is caused by a medication, then, the solution might be as simple as stopping that medication.
Yeah.
But if it's related to the rheumatoid arthritis itself, then, treating that underlying disease becomes super important.
So treat the root cause, not just the symptom.
Exactly.
I got it. Now, are there any specific medications that can help with ILD?
Yeah, there are some. The textbook mentions a couple. Nintedanib and pirfenidone. They're used for a specific type of ILD called idiopathic pulmonary fibrosis.
Okay.
But it's important to note those might not be appropriate for every type of ILD.
Right, of course. Now, the textbook, it kept mentioning that there are different types of ILD and that some are more serious than others.
Uh-huh.
So what are the main differences? Like, why does it matter so much which type you have?
Yeah, great question. So one of the big distinctions the textbook makes is between two patterns they see. UIP, which stands for usual interstitial pneumonia, and then there's NSIP, which stands for nonspecific interstitial pneumonia.
Okay, I'm not a doctor, so what does that mean for, like, a regular person?
So basically, the big difference is that UIP, which is more common in people with rheumatoid arthritis, unfortunately tends to have a worse prognosis. It's more likely to get worse over time, similar to idiopathic pulmonary fibrosis. It's like a more aggressive form of scarring in the lungs.
Oh, I see.
Now, NSIP, on the other hand, is more associated with inflammation, and it might actually respond better to treatments like steroids or immunosuppressants. So there's a chance it could be reversed, or at least, controlled more effectively.
Okay.
So knowing which type you have, it really makes a difference for the outlook and the treatment options.
So it's like before you can even think about treatment, you got to figure out what you're actually dealing with.
Yeah, exactly. It's like figuring out the terrain of a map before you set out on a journey. You and your doctor need to know what you're up against to make the best decisions.
Okay, so we've been talking a lot about ILD, but earlier you mentioned a whole bunch of other lung issues that could be tied to rheumatoid arthritis. Should we be as worried about those as we are about ILD?
That's a good question. ILD definitely gets a lot of attention, but those other conditions are important too.
Right.
Let's see, you mentioned bronchiectasis earlier. Think of your airways like branches of a tree, right? So with bronchiectasis, those branches get all damaged and widened. Like imagine someone stretched them out too much.
Yeah.
And that creates all these little pockets where mucus can build up. It becomes like a breeding ground for bacteria and infections.
Oh, yuck.
Yeah, not great. And this can actually happen directly because of the rheumatoid arthritis.
Oh,
Well, the inflammation from the rheumatoid arthritis can actually damage the airways. It can also be a side effect of those immunosuppressant medications that people with rheumatoid arthritis often have to take.
right, because if your immune system is suppressed, you're more susceptible to infections anyway.
Exactly. It's kind of
Hmm.
a double-edged sword.
Right, right.
And then you've got things like pleural effusions. That's when fluid builds up in the space between the lungs and the chest wall. And pleuritis, which is inflammation of the lining of the lungs.
Oh, so it's not just the lungs themselves. The stuff around the lungs can be affected too.
Exactly. And even the diaphragm can be impacted. That's the muscle that helps you breathe, right? The textbook mentions this thing called a raised hemidiaphragm. That can happen because of nerve involvement from something called vasculitis.
Oh, yeah.
It's basically when your blood vessels get inflamed, and that inflammation can sometimes mess with the nerves that control the diaphragm.
Wow, so this is all super interconnected.
It is, and that's why it's so important to think about rheumatoid arthritis holistically. It's not just about the joints. You have to think about how it might be affecting other organs and systems, like the lungs.
So doctors really have to be like detectives with this, huh?
They do. They have to be looking for all these little clues and connecting the dots.
Yeah.
And that's why it's really important for patients to be upfront with their doctors about any symptoms they're having, even if it seems totally unrelated. Something as simple as like a cough that won't go away or feeling short of breath could be a sign that something more serious is going on with the lungs.
It's all about communication, being proactive,
Mm,
both on the patient side and the doctor's side.
totally. And speaking of communication, there's this interesting thing in the textbook. It talks about how doctors can use this really simple technique during an exam to help narrow down the possibilities.
Mm.
Remember those crepitations we talked about, the crackling sounds?
Yeah, yeah.
So the textbook says the doctor can ask the patient to cough.
Wait, why?
I know, it sounds weird, right? But it's actually a pretty clever way to tell the difference between certain lung conditions. By asking the patient to cough, the doctor can see if those crackling sounds change or go away.
Oh, interesting.
Yeah, it can help them figure out if the crepitations are from something like ILD or bronchiectasis, or if they're from something else entirely, like heart failure or pneumonia.
So it's like a little test.
Exactly. Just
Yeah.
a simple but effective way to gather more information.
I'm sensing a theme here. Thoroughness, attention to detail, and a willingness to think outside the box. Seems like those are pretty important qualities for any doctor treating someone with rheumatoid arthritis, especially when it comes to lung complications.
Yeah, couldn't agree more. That kind of attentive approach is so important, not just for diagnosis, but for monitoring those long-term effects of rheumatoid arthritis on the lungs.
That's a good point. What kind of long-term effects are we talking about here?
Well, the textbook mentions a few pretty serious complications that can come up from chronic lung disease. Things like central cyanosis, pulmonary hypertension, and cor pulmonale.
Wow, those sound pretty intense.
They are.
Can you break those down a bit? Like, what is central cyanosis?
Sure. So cyanosis is when your skin and mucous membranes turn kind of bluish
Oh, okay.
It's a sign that your body isn't getting enough oxygen. And central cyanosis specifically, that's when you see that bluish tint around the lips, the tongue, the face. It's a signal that something's off with the oxygen supply. Often means there's a problem with the heart or lungs.
It's like a visual clue that something needs attention.
Exactly.
Makes sense.
And then there's pulmonary hypertension. That's high blood pressure in the arteries of your lungs. Makes it harder for the heart to pump blood through the lungs. And over time, it can lead to heart failure.
Oh, wow. That's scary.
It is. And then you've got cor pulmonale. That's when the right side of your heart gets enlarged and weakened because it's working so hard to pump blood through those damaged lungs.
So it's like the heart is trying to overcompensate and eventually it just can't keep up.
Yeah, that's a good way to put it. And that can lead to a whole bunch of other problems. Fatigue, shortness of breath, swelling in the legs and ankles, even an irregular heartbeat.
It seems like rheumatoid arthritis can really have a domino effect on the body, huh?
It can. And it can lead to some pretty serious health challenges down the road. But the good news is, with early detection, careful monitoring, and the right treatment, a lot of these complications can be prevented or at least managed effectively.
That's good to hear.
Yeah, and that's why it's so important for people with rheumatoid arthritis to have regular checkups with their doctors, even if they're feeling fine. Because sometimes these complications can sneak up on you. No noticeable symptoms in the early stages.
So staying one step ahead is key.
Exactly. And that brings us back to something we were talking about earlier, patients being their own advocates. At the end of the day, you know your body best, right?
Yeah,
And you're the one who's going to have to live with the decisions that are made about your care.
that's a really good point.
Yeah.
So what does it mean to be an effective advocate for yourself when it comes to managing rheumatoid arthritis and how it affects your lungs?
Well, it starts with being informed. Do your research, ask questions, and don't be afraid to push back if you think something isn't right.
Right.
You also have to be proactive about your health. Pay attention to any changes you notice, and don't wait to see a doctor if something feels off.
And I imagine having a good relationship with your doctor is important too.
Yeah. Absolutely. Finding a doctor who listens to you, respects your concerns, and is willing to work with you to come up with a treatment plan that actually meets your needs. That's huge.
It's a partnership.
Exactly. And that partnership should go beyond just the doctor's office. Maybe it means connecting with support groups, looking for reliable information online, or even participating in clinical trials.
So it's about building this whole support system around you.
Yeah, and that support system can make a world of difference when you're dealing with a condition like rheumatoid arthritis.
We've covered a lot in this deep dive, huh? I mean, it's amazing how much there is to know about rheumatoid arthritis and how it affects the lungs.
It really is. We've just scratched the surface, honestly.
I know, right? But I think we've done a pretty good job of hitting those main points, like how rheumatoid arthritis can affect the lungs in all these different ways, from ILD to bronchiectasis to pleural effusions.
Yeah, absolutely. And we talked about how important it is to catch things early, get the right diagnosis, and, make sure the treatment plan makes sense for each person.
For sure. And we also touched on that whole idea of being your own advocate.
Right, being informed, asking questions, working closely with your healthcare team. That's all so crucial.
Totally. Now, before we wrap up, there was one more thing I wanted to ask you about. The textbook mentioned something called pulmonary nodules. What are those exactly? And should people with rheumatoid arthritis be worried about them?
Oh, good catch. Yeah, so pulmonary nodules, those are basically small, round growths in the lungs.
Okay.
They're actually pretty common, could be caused by a bunch of different things like inflammation, infection, or even sparring.
Mm.
Now, when it comes to rheumatoid arthritis specifically, the textbook says that these nodules are usually not a big deal.
Okay.
They don't usually cause symptoms or, affect your overall health.
So that's reassuring.
Yeah, but doctors still need to keep an eye on them.
Oh, right. Why is that?
Because even though most of the time those nodules in people with rheumatoid arthritis are benign, which means they're not harmful, there's always a chance they could be a sign of something more serious, like, lung cancer. So it's always better to be safe than sorry.
Definitely. It sounds like knowing what to make of those findings, it can be a little tricky.
It can.
I guess that's another reason why having a doctor who really understands rheumatoid arthritis is so important.
Absolutely. Experience matters, especially with a complex condition like this. The textbook actually brings up this interesting point about pulmonary nodules and rheumatoid arthritis. Turns out they're more common in people who are seropositive.
Seropositive, now remind me what that means.
Yeah, sure. So seropositive basically means that someone has certain antibodies in their blood, and these antibodies are associated with a more severe form of rheumatoid arthritis.
So it's like another clue for doctors.
Exactly. It gives them more information to assess the patient's risk and figure out the best treatment.
And is there a connection between those and those rheumatoid nodules, the bumps you can sometimes get under your skin?
There is. People who are seropositive are more likely to get those rheumatoid nodules too, those, firm bumps under the skin, usually near the joints.
So those external nodules and the internal ones in the lungs, they're connected.
They are. It just goes to show you how rheumatoid arthritis can affect the whole body.
It's not just about the joints.
Nope, it's systemic.
Or I think that's a really important takeaway from this deep dive. Rheumatoid arthritis is a complex disease with a lot of moving parts, and managing it takes a team effort.
For sure. And hopefully this deep dive has given you some useful information, helped you understand things a bit better.
We've talked about how rheumatoid arthritis can impact the lungs in so many different ways, how important it is to catch things early, get that diagnosis right, and create a treatment plan that really fits you.
Yeah, exactly. And don't forget, you have a voice in all of this. You have a right to ask questions, advocate for yourself, and work with your doctor to get the care you need.
Before we go, I do want to leave you with one last thought to um, ponder. Treating rheumatoid arthritis-related lung issues, it can be pretty complicated, right?
It can.
You might be looking at clinical trials, new medications, all kinds of decisions to make.
Right.
So I guess the question is, what kind of resources are out there to help patients navigate all that?
That's such a good question. And I really encourage you to explore that further. There are so many great organizations and online communities that are specifically for people with rheumatoid arthritis.
Oh, awesome.
They can be amazing sources of information, and guidance. And they can also connect you with other people who get it, other people who are going through similar things.
That's so important. So yeah, keep learning, keep those questions coming, and keep advocating for yourself. The more you know, the better equipped you'll be to manage all the challenges that come with rheumatoid arthritis. And make sure you're taking good care of your lungs.
Couldn't have said it better myself.
Yeah.
Remember, you're not in this alone. There's a whole community out there ready to support you every step of the way.
Oh, good to Brielle. Well, thanks for joining us for this deep dive, and we'll catch you next time.